Good evening dear friends. I am Jasila Mujib welcoming you to a brand new episode of BMC Global Live AL-HILAL Health World, nothing but lifestyle. Your health is our concern. So in each episode of this talk show, we bring before you an expert doctor from AL-HILAL Hospital to address your various health issues. Today the topic we are going to discuss is about the various gynecological problems. I am sure most of you would be interested. And the doctor joining us today is Dr. Meena Navani from AL-HILAL Hospital, Manama. She is an obstetrician and gynecologist and she comes with a wealth of experience of more than 27 years. So, doctor, welcome to the show.
Thank you so much.
And thank you for joining us today.
Thank you for having me here.
So, doctor, what are the common gynecological health issues found in women?
Gynecological health issues for women generally start from puberty to perimenopause, menopause until life. So generally these are like the symptoms or the problems which are maybe because of the hormonal issues or maybe because of reproductive or sexual life. So in short, I will just categorize them into few. One of them is like menstrual irregularities. Irregularity means it can be a frequent cycle, which is like we call it less than 21 days gap between the two cycles, or if it could be delayed cycles. That means if the gap between the two cycles is more than 40 days. Or it could be different bleeding pattern altogether. That means it can be scanty bleeding or it can be heavy bleeding as such. Other abnormal bleeding patterns can be like intermenstrual bleeding, postcoital bleeding, which means bleeding after the sexual contact, or postmenopausal bleeding. Apart from this, period pain or what we call it menstrual cramps or dysmenorrhea, that is one of the commonest problems which we encounter. Then abnormal vaginal discharge. Normally also little bit of vaginal discharge is there, which we call it as a physiological one. Now physiological means it is there at certain times of period. It is after the period, just before the period, or in between, like in a mid cycle. But if that is there, that is normal because it does not cause any itchiness or does not have any odor. So this is a normal thing. But if any variation from this, something like any different color, or it is smelly or having some particular odor, or it is giving rise to itchiness, then that is an abnormal vaginal discharge. Then it can be pain in abdomen. Pain in abdomen, apart from gynec causes, it has other reasons also. As far as gynecological reasons, it may be limited to maybe urinary tract infection, or maybe some fibroid or ovarian cyst or endometriosis, or it could be some twisted ovarian cyst, or it can be something like pelvic inflammatory diseases. Then we have general endocrine issues like PCOS, which is like obesity, excessive facial hair growth which is abnormal, and acne and excessive pigmentation. And other thing I would mention over here is infertility. When a couple is unable to have children, that is one of the commonest things which we encounter.
Now can you explain about puberty, perimenopause and menopause in detail for us?
Okay, so the terms puberty means when actually a girl is in a growth phase. It can be like for boys as well as girls, and it's like when they develop the secondary sexual characters and the girl starts getting her menstrual cycle. And menopause is when a lady stops getting her periods. We call it she has attained menopause if it has been more than 12 months that she has not got her menstrual cycle. Okay. Perimenopause is a period which is like generally around 1 to 2 years of period, which is a transition phase where she has irregular hormones, and that's then she may lead to menopause. Postmenopause is after the menopause till life.
So doctor, these days we hear young girls complain about period pains and other period issues, and they are reluctant to visit the gynecologist. So what is your suggestion?
Okay, if any young girl or lady who is having period pain or heavy bleeding, and because of this she has to remain absent for her routine chores or maybe college or maybe workplace, then it calls for attention. It has to be, she has to go to a doctor and go for the consultation. We have to examine and find out the reason. Maybe she may have ovarian cyst or a fibroid which is giving rise to heavy bleeding or period pain. Apart from this, I would take this opportunity, if a young girl or a lady comes to me, I would take this opportunity and clear some myths and misconceptions which generally they have because of the partial knowledge which is obtained from the internet and peer group discussions.
So now you mentioned already about PCOS. Can you explain it in detail for us?
Okay. Basically PCOD, which was the initial term, it's polycystic ovarian disease, but now we know it's not a disease. So now the new term is PCOS, which means polycystic ovarian syndrome. Syndrome means it's a combination of multiple things. If I want to label something as a PCOS, does not mean that she has to have all the symptoms or all the clinical presentations. Generally, the basic problem in the PCOS is hormonal irregularity, in which the male hormone, which is normally there in all the women, dominates over the other hormones. That is why the symptoms of PCOS. Now, the male predominance of the hormone, it causes irregular ovulation and anovulation, because of which the periods may be irregular. Then there can be acne, there can be excess facial hair growth, what we call it as a male pattern hair growth, and then obesity, excessive pigmentation again, and then this may lead, if not tackled at earlier stage, this may lead to infertility. Apart from this, these women generally have early onset of diabetes mellitus if not tackled at earlier stage, and they have endometrial hyperplasia as well. Now, as far as management of PCOS is concerned, it has to be a comprehensive approach with the checking of hormones, doing ultrasound, and then if the hormone disturbances is too much, we have to give them hormonal support. The mainstay of the treatment or management of PCOS is a lifestyle modification, by which I mean weight reduction with the help of diet and exercise. Again here, the diet and exercise has to be such which can be followed for lifelong. It should not be something like a crash course of dieting for 7 days, which will not work. Apart from treating the medical thing, then the cosmetic things also come into picture, for which we may need something like cosmetic treatments like laser hair reduction or management of or treatment of acne. But the thing is, both the things have to go together, the medical line of management along with cosmetic management. Single treatment will not work for them.
Okay, so doctor, what is HPV and what is HPV vaccine?
HPV is human papilloma virus, which is strongly associated with cervical cancer. Now, cervical cancer is one of the commonest cancers in women apart from breast cancer. Cervix is actually the lowermost part of the uterus, which is like in the late term we can say it is mouth of the baby bag. Now, this vaccine, because we know the reason, there is a vaccine and this comes in different types, like we have vaccines which cover only 2 types of viruses. There are vaccines which cover 4 types, and the latest one is the one which covers 9 types of viruses. So, we definitely advise going for HPV vaccine. The principle is it should be given early, at early age, actually before the first sexual intercourse. So, ideally we suggest like from 9 years onwards up to 46 years of age, but if anyone has not taken any vaccine before, this is the right time you can start taking the vaccine. And if it is taken less than, when a girl is less than 15 years of age, we need to give only 2 doses. If it is given after 15 years of age, then we need to give 3 doses over 6 months.
Okay. Now, how do we know that a woman has endometriosis or an ovarian cyst or fibroid? How to diagnose?
So, the fibroid is a swelling inside the uterus. It can be anywhere in the body of the uterus or lower part of the uterus, what is cervix, and it can be anywhere between the 3 layers of the uterus. So, the presentation, symptoms, everything depends on where it is and what is the size of the fibroid. Whereas, ovarian cyst is something which is a fluid filled balloon like swelling in the ovaries. Again, this is hormone dependent. And endometriosis, when we have ectopic endometrium, means endometrium apart from uterine lining, if it is present somewhere else, then this gives rise to endometriosis. This tissue can be present in ovaries, fallopian tubes, intestine, anywhere actually, even in subcutaneous tissue. Generally, the symptoms for all these things are heavy bleeding, period pain, irregular cycles, and for endometriosis, it is generally dyspareunia, which is having painful sexual intercourse. So, once the patient comes or lady comes, walks into the clinic, we examine them, and with the suspicion of any of these, we generally advise the ultrasounds. And if needed, we have to go for further specific testing like some hormone testing or MRI for the further line of management.
So, doctor, can you explain about the screening tests in gynecology?
Yeah, screening test is something, the test which can be done to detect any disease, especially the cancers at a very, very early stage. There are multiple screening tests, but as far as gynecology is concerned, a woman, the most common cancers found in women are the breast cancer, cervical cancer, uterine as well as ovarian cancer. So, we have some screening tests. For breast, we have mammogram and ultrasound of breast. And for other pelvic cancers, we have ultrasound, some special blood tests like CA125 or CEA, and for cervical cancer, we have pap smear and HPV testing. Now, we all know about the mammogram and blood test and ultrasound, but for pap smear, generally it is seen that people are little scared, like to go for the pap smear thinking that it is going to be a painful test, but it is a very simple OPD procedure. It is absolutely painless, doesn't require any anesthesia. It can be done just like a simple internal examination, and by doing an internal examination, we collect some cells on a soft silicone brush and we send it to the laboratory. Now, there is one more test which is called HPV co-testing along with pap smear, in which we test the cells along with HPV virus in the pap smear itself. So, these screening tests are to be done at periodic intervals. Like now, we say that pap smear is to be done after 21 years, every 3 years. But after 40 years, it has to be done more frequently. But when we combine this pap smear with HPV co-testing, it has to be done once in 5 years. But these regular intervals may vary in some people who have family history. So, for them, like people who have family history of having some relative having breast cancer or cervical cancer, we need to do all these tests at a frequent intervals.
So, doctor, any tips from your side for the elderly women in the family?
Elderly women in the family generally fall into the category of perimenopausal, menopausal or postmenopausal age group. So, generally at this time it is because the ovaries slowly stop functioning. So, there is lack of estrogen hormone, which is a transition phase over years. So, ultimately because of lack of estrogen, there are multiple things which they have, like something like hot flushes. Suddenly she feels very hot, suddenly she feels everything is cold. Then there can be mood swings, lack of sleep, irritability. She is not feeling capable of doing anything, like bony pains and tiredness all the while. Or there may be, because of lack of estrogen, again there may be vulvovaginal symptoms like vaginal dryness, because of which there will be sexual dysfunction. Then there will be recurrent urinary tract infections, and somehow it is seen that estrogen hormone is cardioprotective. So, they, because that estrogen hormone is not there now, so they have more chances of getting into cardiovascular and metabolic symptoms. So, that has to be taken care of. Now, as far as management of postmenopause or menopausal lady goes, there are different type of approaches. First of all, medical line of approach. If the hot flushes are too troublesome or worrisome for her, then we have to start them on HRT, which is hormone replacement therapy. But a word of caution over here is that it has to be done especially under guidance of, strictly under the guidance of a gynecologist. She has to be under care of a physician for her cardiac and metabolic problems. As far as vulvovaginal dryness and recurrent infections, we can offer her vaginal lubricants. Then one more important thing I would suggest over here is, at this time she needs full support from the family. So, it has to be a counseling not only for the lady, but for the family as well. She has to change her lifestyle, little bit of addition of some low intensity workouts, something like yoga, meditation, some relaxation techniques, and some hobby maybe she can pursue, which is like taking a bath seat since very long because of her busy schedules, and calcium and vitamin D supplements to take care of her bone health, and not to forget the screening tests, which are very important at this particular age.
And finally, doctor, any suggestions for our viewers?
Yes, viewers, to all the ladies, I would suggest, take priority of your health. It is very important that you keep yourself healthy. Do some changes in your lifestyle. Go to your doctors for your screening tests and regular checkups. Don't ignore the symptoms, however mild or benign they may be. Don't ignore any of the symptoms. Take medical help. Stay happy and stay healthy.
And finally, before we wind up, doctor, what do you have to say about AlHilal Healthcare?
I feel I am privileged to be part of AlHilal family, which is the largest healthcare provider in the Kingdom of Bahrain. at AL-HILAL, we believe that women's health is of utmost importance, as she is the backbone of the family and the society as well. So, we cater to their health needs, whatever, right from puberty to reproductive age group, family planning and menopause, everything under one roof.
Thank you, doctor.
Thank you.
Thank you for being with us, and I am sure the viewers would be benefited from your talk.
Thank
you
so
once
much.
again.
Thank you for having me here. Thank you.
So, viewers, I hope this episode was very useful to clear all your doubts about gynecology. And till we meet again in yet another episode with another topic, this is Jessila Mujib signing off. Good night.